A nasal septal deviation refers to a condition where the nasal septum, the thin wall of bone and cartilage that divides the nasal cavity into two nostrils, is displaced or bent to one side. This condition is common and can range from mild to severe, depending on the extent of the deviation. The nasal septum is supposed to be relatively straight in the middle of the nose, allowing for equal airflow through both nostrils. However, when the septum is deviated, it can cause uneven airflow, which may result in breathing difficulties or other symptoms. Causes of nasal septal deviation. Nasal septal deviations can occur due to a variety of reasons, with the two main causes being 1. Congenital. Some individuals are born with a deviated septum. In many cases, the deviation occurs during fetal development, and the nasal septum may not form symmetrically. 2. Trauma or injury. Another common cause of nasal septal deviation is an injury to the nose, often as a result of accidents, sports, or physical trauma. These injuries can lead to the displacement or bending of the septum. Even minor injuries, such as a blow to the nose or a fall, can contribute to a deviation, particularly if the cartilage and bone structures have not fully developed. Symptoms. While many people with a deviated septum do not experience significant symptoms, others may face challenges due to impaired airflow and other related issues. The symptoms can vary based on the severity and the location of the deviation. Common symptoms of a nasal septal deviation include 1. Nasal congestion, one of the most common symptoms, caused by restricted airflow through one or both nostrils. This can lead to a feeling of blocked nasal passages, particularly on the side of the deviation. 2. Difficulty breathing. Due to the obstruction in one or both nostrils, breathing may become more difficult, especially when lying down, exercising, or during sleep. 3. Frequent sinus infections. A deviated septum can make it harder for the sinuses to drain properly, leading to a higher frequency of sinus infections, sinusitis. 4. Mouth breathing. If nasal passages are blocked, people may be forced to breathe through their mouths, which can cause dry mouth, sore throat, and increased susceptibility to respiratory infections. 5. Snoring and sleep apnea. A deviated septum can contribute to snoring, and in some cases, it can aggravate sleep apnea, a condition where breathing is temporarily interrupted during sleep. 6. Facial pain. In some cases, people with a deviated septum may experience facial discomfort or pain, especially in the nasal area or sinuses. 7. Headaches. Some individuals report chronic headaches or migraines, which may be associated with the nasal obstruction caused by the deviated septum. 8. Postnasal drip. A deviated septum can lead to excess mucus production, which may drip down the back of the throat, leading to discomfort and an irritating cough. Diagnosis. A nasal septal deviation is usually diagnosed through a physical examination by a healthcare provider, typically an ear, nose, and throat ENT specialist. The doctor will examine the inside of the nose using a nasal speculum or an endoscope to get a detailed view of the nasal passages and the septum. Risk factors for a nasal septal deviation typically relate to both congenital present at birth and acquired causes. Here are the main risk factors. 1. M genetics. Congenital factors. Family history. A nasal septal deviation can run in families. If your parents or siblings have had this condition, there may be a higher chance that you will develop it as well. Intrauterine factors. Abnormalities during fetal development can result in a deviated septum. If the nose develops unevenly in the womb, it can lead to a deviated septum at birth. 2. Trauma or injury. Acquired factors. Nasal trauma or injury. The most common risk factor for a deviated septum is trauma to the nose. This could be due to sports injuries, for example, contact sports like football or hockey, accidents or falls, physical altercations or fights, for example, broken nose. 3. Environmental factors. Exposure to environmental hazards. In rare cases, factors like prolonged exposure to certain chemicals, pollutants, or irritants could contribute to nasal issues, potentially leading to a deviated septum or exacerbating an existing deviation. Chronic sinus infections. Although not a direct cause, chronic inflammation or infection of the nasal passages may worsen existing septal deviations, leading to more severe symptoms or complications. 4. Age-related changes. In some cases, Septal deviations can become more noticeable with age as the cartilage and bones in the nose weaken or shift over time. However, this is less common than congenital or traumatic causes. 5. Gender. Some studies suggest that males may be more likely to experience a deviated septum due to a higher incidence of trauma or injury, although it can occur in both genders. 6. Chronic allergies or nasal conditions. Chronic allergies. People with chronic allergic rhinitis or other nasal conditions may experience frequent swelling and congestion in the nasal passages, which can worsen the symptoms of a deviated septum. Nasal polyps. The development of nasal polyps, benign growths in the nasal passages, can also exacerbate the symptoms of a deviated septum. Understanding the risk factors for a nasal septal deviation can help in prevention or early intervention, especially when it comes to traumatic injuries. For those who have genetic or congenital risk factors, regular checkups with a healthcare provider can help in managing symptoms before they worsen. Treatment. The treatment for nasal septal deviation depends on the severity of the condition and the associated symptoms. Many people with mild deviations do not require treatment, especially if the deviation does not cause significant problems. However, for those who experience symptoms, various treatment options are available. 1. Medications, decongestants. These can help reduce swelling in the nasal passages, improving airflow. They are available in both oral and nasal spray forms but should be used cautiously to avoid dependency. Antihistamines. These can help reduce symptoms of allergies, which may worsen the symptoms of a deviated septum. Nasal steroid sprays. These sprays help to reduce inflammation in the nasal passages, improving airflow and reducing congestion. 2. Nasal strips. Over-the-counter nasal strips, which are applied to the outside of the nose, can help open the nasal passages, allowing for easier breathing. These are particularly useful during sleep for those who snore. 3. Surgical treatment. Septoplasty. If the symptoms are severe and non-surgical treatments are ineffective, surgery may be recommended. The most common surgical procedure for correcting a deviated septum is septoplasty. In this procedure, the surgeon straightens or removes parts of the deviated septum to improve airflow and alleviate symptoms. In some cases, if the deviation is caused by both the bone and cartilage, the surgeon may also perform a rhinoplasty cosmetic surgery to enhance the appearance of the nose. Complications. While a nasal septal deviation itself is not typically life-threatening, it can lead to complications if left untreated or if it causes chronic symptoms. These complications can include chronic sinus infections. A deviated septum can obstruct sinus drainage, leading to frequent or persistent sinus infections. Sleep disturbances. Conditions like snoring and sleep apnea, which may worsen with a deviated septum, can significantly impact sleep quality and overall health. Worsening of allergies. A deviated septum can make allergic reactions more difficult to manage due to the reduced ability to clear nasal passages. Conclusion. Nasal septal deviation is a common condition that can significantly affect a person's quality of life, particularly if it leads to difficulty breathing, sinus infections, or sleep disturbances. Fortunately, a range of treatment options are available, from medication and lifestyle changes to surgical intervention. If you suspect you have a deviated septum and are experiencing symptoms, it's essential to consult a healthcare provider to explore appropriate treatment options. Thank you for watching my video. Please subscribe my channel.